in personal spending, partially offset by $1.9 million in greater than planned OTPS expenditures for contracted services. MOCJ also oversees a substantial contractual budget projected in the executive plan at $631.8 million for FY24. That is a $348 million decrease from the amount managed at adoption for FY23. The decrease is largely due to transfer of contracts to DYCD, as well as PS and OTPS reductions. My questions today will largely focus on MOCJ's work with public defenders, particularly delays in contract processing and overall funding issues. City contracting delays, as we all know, has been a long problem with nonprofits, but these delays directly affect a person's ability to have a defense in court when they cannot afford representation. We've also been joined by council members Ariola and Holden. I'm now going to turn to my co-chair for this hearing, Chair Hanks, for her opening statement.
Thank you, Chair Brennan. Good afternoon, and welcome to the fiscal 2004 executive budget hearing for the Committee on Public Safety. My name is Camila Hanks, and I am the chair on the Committee on Public Safety. Today, we will review the fiscal 2024 budget for the Mayor's Office of Criminal Justice to better understand how they address the protections for New Yorkers involved in the criminal justice system. I'd like to also welcome Director Deanna Logan and her team, and I'd also like to recognize Councilmember Sanchez, who joined us. The Mayor's Office of Criminal Justice advises the Mayor on all matters relating to the maintenance and improvement of a fair and equitable justice system. Under this guiding principle, MOCJ works to bring together community and law enforcement to address the issues that affect the safety of our neighborhoods. The agency's fiscal 2024 executive operating budget totals $10.2 million, including $4.9 million for personnel services and $5.4 million for other than personal services, OTPS. The agency also has contracts budgeted of $631.8 million, which supports $359.4 million for indigent defense and $272.3 million in criminal justice programs. With that context, I would like to welcome and thank MOCJ for the work that they do, and I'm looking forward to hearing from the Commissioner today. During today's hearing, I look forward to learning more about the Office of Neighborhood Safety contracts transferred to the Department of Youth and Community Development, as well as MOCJ's funding for legal service providers. This plan included several new needs for MOCJ, but decreased the agency's budget by $2.6 million in operating funds and $348 million in contracts. I am concerned about the details of this contract transfer and the ability of the agencies involved to maintain programming without interruption of funding and services. I would also like to further discuss that in today's hearing. The committee would also like to hear about this and other budgetary changes in the Adams administration's budget. I look forward to learning more about the Mayor's Office of Criminal Justice and the important role that it has in the lives of many New Yorkers. And I want to thank our committee staff for their hard work, the financial analyst, unit head Jack Story, senior counsel Josh Kingsley, legislative policy analyst Chad Benjamin, and my director of legislation David Pena, and my senior advisor, director of budget Paul Casale. I'm going to pass it along to our committee counsel for a few procedural items. Thank you, Chair.
Thank you, Chair Hanks. Before we get started, my thanks also to Casey and Tanvir from Council Finance for preparing for both of today's hearing. Of course, my committee counsel, Mike Toomey, my senior advisor, John Yedden, and really the entire finance team that works so hard behind the scenes to make these hearings possible. I'm now going to turn it over to Mike Toomey, our committee counsel, to swear in the witnesses so we can get started on testimony.
Good afternoon. If you raise your right hands, please. Do you affirm that your testimony will be truthful to the best of your knowledge, information, and belief, and you will honestly and faithfully answer council member questions? Deanna Logan?
I do.
Nora Daniel?
I do.
Candace Julian?
I do.
Sam Solomon?
I do.
Thank you. You may begin.
Good afternoon. Good afternoon, Chair Hanks, Chair Brannon, and members of the Committee on Public Safety and Committee on Finance. As we have all said, my name is Deanna Logan, and I am the Director of the Mayor's Office of Criminal Justice, affectionately referred to as MOCJ. I'm joined today by Nora Daniel, who is our Chief of Staff at MOCJ, Candace Julian, who is our Chief Operating Officer, and Sam Solomon, our Deputy Director for Policy and Justice Operations. Thank you for the opportunity to testify about MOCJ's budget and priorities for this year. MOCJ is the think tank and coordinating entity for the city's criminal justice system. We advise Mayor Adams on criminal justice policy and serve as the mayor's representative to the courts, district attorneys, defenders, the state criminal justice agencies, among others. MOCJ works with law enforcement, city agencies, not-for-profits, foundations, and the public to implement data-driven anti-crime strategies and promote the operation of a fair justice system. These include projects to address current crime conditions, prevent offending, and build strong neighborhoods that ensure enduring safety. MOCJ teams work along a public safety continuum grounded in supporting healthy neighborhoods that promote safety. We are committed to working with all of our partners to design and implement solutions that strike the right balance between enforcement and promote accountability and the interventions that afford healing and rehabilitation, all in the pursuit of safety and justice. The executive budget has MOCJ itself funded for approximately $10 million in personnel and operating costs. MOCJ teams have a budget to distribute of approximately $600 million across human service contracts that support the efficient operation of the criminal justice system and public safety. In order to meet our mission, we are staffed with professionals in various teams. Our teams include policy, justice operations, alternatives to incarceration, reentry, transitional housing, our Office of Crime Victim Services, supports, Office to Prevent Hate Crimes, and the Office of Special Enforcement, which many of you know as OSE. All of this is anchored by work conducted by our research teams that support the mayor's vision of keeping New York the safest big city in America. As MOCJ concentrates its efforts on the entities that most directly touch the criminal justice system, we transitioned our Office of Neighborhood Safety, referred to as ONS, to work under the Department of Youth and Community Development, or DYCD. It continues its work of establishing the sustainable supports that are the building blocks of healthy communities. ONS works to prevent individuals from entering the criminal justice system. It empowers individuals of neighborhoods most negatively impacted by gun violence and crime. ONS invests resources, fosters engagement in the civic processes, and reclaims spaces to lay the building blocks of healthy, strong neighborhoods. As Mayor Adams has clearly stated, housing stability is a fundamental building block of public safety. And in support of Mayor Adams' blueprint to create and preserve affordable housing, MOCJ's OSE brings together inspectors from the Buildings Department, the Fire Department, and legal professionals who work daily to support the maintenance of housing stock by reclaiming housing units from illegal short-term rentals. As the entity this council entrusted with the oversight and implementation of Local Law 18 of 2022, OSE spent the last year diligently creating the registration system that affords for a structured safeguard for legal short-term rentals. We are proud to report that we are continuing to onboard staff in this area, implement new software, and answer constituent questions on short-term rental registration as we move into the enforcement period later this year. We are fully committed to ensuring that the most vulnerable New Yorkers are also able to have a place to lay their heads. As council may remember, during the height of the pandemic, to meet the public health crisis and to save lives, MOCJ mobilized partners to create emergency hotels that provided humane living spaces for individuals who were formerly incarcerated on Rikers Island and people released from state prisons. As we exit this COVID health crisis, we employ lessons learned. We're ending our emergency housing initiative and moving into the more sustainable model of transitional housing. Headed by Yolanda Johnson-Peterkin, one of this year's recipients of the Sloan Public Service Award that honors exemplary public service, we are ensuring that housing for people with criminal justice involvement meets the individuals where they are by providing interventions and wraparound services specific to the person. Our transitional housing initiative incorporates the immediacy that we understood all too clearly from the public health crisis is critical to the successful transition of individuals, with a key focus on allowing the person to build a stable foundation that allows them to move into permanent housing. In the last few months, our transitional housing initiative has worked with key partners to focus on an open mind, open door campaign that asks New Yorkers with permanent rental units to open their minds and their hearts to those individuals with criminal justice history that are ready to start the next chapter of their lives. This education campaign has successfully reached landlords and brokers across the city and provided opportunities for landlords and brokers to interview and accept tenants, people in need of a second chance. Education is a key component of MOCJ's ability to support safety in New York City. Our Office to Prevent Hate Crimes, or OPHC, plays a critical role in coordinating not only the prevention, but also response to hate and bias crimes. As hate crimes rose during the public health emergency, OPHC mobilized its networks of community groups, approximately 80 of them, and leaders, and bolstered its commitment to inform and heal the public. The office is implementing Mayor Adams's Breaking Bread and Building Bonds initiative to bring individuals together from different backgrounds, share a meal, find common ground. Participants from events have provided overwhelmingly positive feedback, and more New Yorkers are volunteering to host additional dinners and welcome people, including elected officials, not-for-profits, and philanthropic organizations to share that meal. OPHC also implements the Partners Against Hate PATH initiative, through which partner organizations implement community-based anti-hate initiatives that include programs that will highlight women and girls. Complementing the work of OPHC, our Office of Crime Victim Services maintains services for crime victims across the city while innovatively working pursuant to a federal technical assistant program grant with our partners in the Office of the Kings County District Attorney, New York City Police Department, our sister mayoral unit and gender-based violence, and Help Roads, to develop an intersectional model that addresses the danger of intimate partner violence as it overlaps gun violence. Currently, the initiative is focused on the 73rd Precinct, and the goal is to develop a framework that not only could be deployed across the city, but serve as a national model. As I've said, the foundation of our work is data. Our research, innovation, and policy teams identify concerns that may be a barrier to public safety. Under Mayor Adams' leadership, the city's public safety agencies began a new collaboration to align crime data across the city. MOCJ, NYPD, the Department of Correction, and many providers of city services work together to coordinate data to produce a more accurate picture of public safety and public health within the criminal justice framework. MOCJ has a long-standing relationship with the Office of Court Administration's data team that both drives the data that is available and helps us analyze criminal justice trends. In addition to our sister and state agencies, MOCJ also works with partner service providers, justice-involved people to obtain, review, and analyze not only the quantitative data that's within our systems, but also obtain qualitative data to inform the city government's criminal justice framework. Our unprecedented collaboration across multiple data streams allows us to identify and propose solutions to our city's most difficult public safety challenges. As you know, public safety is an interconnected and holistic. As we know, public safety is interconnected and holistic, and our data-driven public safety interventions reflect this principle. We design and implement fine-tuned initiatives that reflect our understanding that public safety is a common goal of all New Yorkers and requires cooperation by all. Our interventions are specifically designed to promote public safety by providing services that help to keep people from entering or returning to jail or prison. The interventions include addressing case processing, supervised release, alternatives to incarceration, reentry services, and housing initiatives. MOCJ is committed to implementing Mayor Adams' vision of an innovative public safety apparatus that includes initiatives designed to promote the more efficient operation of the criminal justice system. As we know, delays in the criminal justice system are an injustice to both the accused and the victims. MOCJ is currently developing, along with one of our partners, the Center for Justice Innovation, or CJI, an initiative to facilitate better case processing. Pursuant to this initiative, CJI will begin individually assessing cases of people who are incarcerated. CJI will identify to both the district attorneys and the defense counsel eligible programming and jail alternatives for cases they review that appear amenable to services. The goal of this initiative is to work across agencies and stakeholders to decrease logjams and identify systemic barriers to case resolution and provide greater opportunities for case disposition. We were happy to work with the council on Intro 806-A, which codifies this initiative, and we look forward to reporting to this council again on the eventual results of that initiative. In 2016, New York City launched supervised release citywide, offering judges the option of releasing appropriate and eligible individuals under specific supervisory conditions in lieu of setting bail. Supervised release is designed to reasonably assure court attendance and engage participants in social services that may continue past the duration of the individual's case. Participants in supervised release are required to report to program case managers regularly and are offered court reminders and case management services, including connections to mental health, addiction, employment, and peer services. MOCJ currently contracts with 4 organizations to provide supervised release management citywide, and the current overall value of these contracts for fiscal year 23 is approximately $67 million. Innovative public safety strategies like the Jail Population Review work to supplement the core strategies and tools that allow the court system to ensure its ability to maintain efficient and just operations. Alternatives to incarceration, also referred to as ATI programming, are court-mandated diversion programs that provide participants with supportive services in their communities instead of jail or prison sentences. ATI programs are key components of the city's investment in reducing the court's reliance on incarceration. MOCJ currently has $34 million in contracts in fiscal year 23 with 14 nonprofit organizations to run 24 alternative to incarceration programs throughout New York City. Our city ATI programs provide behavioral health services, mental health services, substance abuse treatment, counseling, job readiness, education assistance, benefits enrollment, and case management. Overall, approximately 5,660 people were served by our AT programs in the first 9 months of this fiscal year, from July 1st, 2022 through March 31st, 2023. For those individuals that complete a sentence of incarceration and are returning home to their community, ready to start the next chapter of their lives as New Yorkers, MOCJ's reentry programming, the Community Justice Reentry Network, or CJRN, works to provide a supportive transition, including release planning in jail and prison. We invest over $26 million each year into programming, which builds upon the success of the Jails to Job Reentry Services program that was launched in 2018. During incarceration and upon release, interested individuals work with reentry mentors who help facilitate all aspects of reentry on individual case basis. The reentry mentors develop relationships with individuals released to encourage the participants to engage in relevant services and programs. The supports provided by the 10 CJRN service providers consists of wraparound resources determined by the specific needs of each returning individual, and they include paid short-term employment, job training, career certifications, connections to permanent employment, holistic wraparound services that include mental, behavioral, and physical health care, family support and reunification, benefits assistance, case management, and education, plus housing support. The case planning and coordination during incarceration, combined with robust service offerings in the community, help to ease the path to a stable life outside of custody and reduce the likelihood of an individual's return to custody. As I conclude, I'd like to state what I hope that has been made clear from the testimony that we've provided today. Investing in people is an investment in public safety. We continue to strive towards a safer, fairer criminal justice system. We look forward to continuing our progress over the coming fiscal year. We thank you for the opportunity to present testimony on MOCJ's work, and we are happy to answer any of your questions today.
Thank you. We've also been joined by council members Carr, Caban, Velasquez, Osei, Barron, and Joseph. Thank you for your testimony. I want to jump right into it. The district attorneys and defenders sent the city a joint funding letter detailing the crisis levels of attrition and workload they're experiencing. Can you tell us the status of that request?
Thank you for the question. We have been working as an administration, not only with the district attorneys and the defenders, but with our partners in the state to address the funding needs of the defenders and the DAs. We will continue with the Office of Management and Budgets to review and assess based on the funding that has been provided to defenders and DA's offices. We understand that within the state budget that was passed, there was approximately $40 million dedicated to New York City alone for funding from the state, as well as $40 million for New York City DAs, and then an additional $40 million for New York City defender organizations. As the Office of Management and Budget reviews that funding and the needs of the district attorneys and the defenders, we're looking forward to seeing the needs met going into this next fiscal year.
So have you met with the defender organizations and the council programs about their FY24 requests?
We continuously meet with the defenders. We meet with defenders and DAs on a weekly basis, just on different days. Defenders on the Mondays, DAs on the Tuesdays.
And what is MOCJ's plan to advocate for an increase in family defenders' salaries so they're competitive and reflect the training and the important work that they do?
I'm sorry, when you're talking about family, you're talking about family court defender services?
Yeah.
So MOCJ is the entity that administers the Defender budget. So all indigent defense services for the criminal justice system come through MOCJ. We also administer Article 10. We have been working with the indigent legal services for the state to review budgets and funding sources for all of the individuals within that framework of indigent defense. In addition, we have our general counsel that has been talking to and working with family court to assess the needs and to figure out where we can support additional funding for defenders.
Did you believe that family defenders should get a pay increase?
We are still reviewing what the pay scale is and where the needs are, and we hope to be able to address what that should look like in the coming year.
Okay, at our last budget hearing, the defender organizations testified to a significant increase in homicide matters. They also testified that this has been raised with MOCJ and that they were told at the start of their contract should intake increase, they would receive additional funding. But according to legal aid, that hasn't happened. So is there a plan to address the increase in homicide intake and the need for the additional funding of $10 million?
We're continuing to discuss and work with the Office of Management and Budgets. As we are assessing the number of cases, we will continue to go back and review what that funding increase should look like to address any increases in the cases.
Has OMB been open to your suggestions?
OMB is always open to talking to us, so I cannot
I don't want to get anybody in trouble here. All right. It's been reported in the media that MOCJ is also facing a similar attrition crisis. I guess really there's no agency that is not immune. But it's causing additional contract processing delays that obviously, as we all know, significantly impact the nonprofit organizations. So could you tell us what's the status of your staffing issues? How many openings do you have? And are there more openings in some areas than others?
Well, thank you for that question. As you know, last year I came before you and I did say procurement was one of MOCJ's biggest challenges. We are continuing to see attrition in our office as across the city. We're working with DCAS, who has been committed to making sure that we are able to fill our vacancies, as well as OMB to expedite our ability to onboard additional people. We have made sure that we do everything within our power to limit any negative impact to our partner providers, because they are, in fact, providing critical services to New Yorkers. And so I'd like to give it to our Chief Operating Officer, Candace Julian, to really drill down on some of the very specific steps that we have taken in the last year to expedite and really make sure that our partners have resources.
Thank you, Director Logan, and for the question. Specific to our recruiting efforts, we have been working with colleges with criminal justice programs to ensure there is opportunities to intern and recruit from those workflows. We've been working with fraternal organizations across the city and with professional membership organizations to fill those vacancies. At MOCJ, we currently have 69 vacancies. They're across the board. Within our procurement unit, there are 6 vacancies, but we're happy to report that we have 2 contract analysts starting on May 30th. And we continue to work, yes, with our partners at DCAS, within the mayor's office, to ensure that our postings, onboarding is done as expeditiously as possible.
And is there a plan to make sure that FY23 and 24 contracts will be registered by July?
Absolutely. We've implemented best practices from the Contract Backlog Initiative, created redundancies within certain workflows, and are in good track to ensure that most of our contracts are registered on time.
Okay, last question for me is regard to flat funding. Defenders have been testifying to this problem for quite a while. As a result, the defenders note that they are effectively receiving a cut each year because of flat funding. So does MOCJ have a plan to address the flat funding problem in FY24?
Again, we will be working with the Office of Management and Budgets to review what, if any, increases should be happening. We also have to balance out the state infusion of capital that has come into the system for the defenders in that amount of the $40 million that the state has allocated. In addition to the $40 million that was allocated specifically for defenders in New York City, it is my understanding that the state budget, in addition to that, allowed for one of the first times the city to be included in the overall pot of $40 million that was allocated for the state, across the state for defender organizations. So there may be residual funds that comes out of that budget, and then the city will be able to balance out and see where there needs to be additional.
What was the total amount that you received in the state budget?
Across for the defenders or for the DAs as well?
For Mock J, how did Mock J make out in the state budget?
Well, so Mock J doesn't get it.
Right, but you know what I mean. Yeah.
There is approximately $170 million infusion of dollars into the city for the criminal justice portfolio.
And is that more or less than what you were hoping for?
We are happy for anything that the state is willing to make sure that we get to be able to do the work that we do.
You're more diplomatic than I can ever dream to be. Okay, I'm going to hand it over to Chair Hanks, and we'll keep moving. Thank you so much, Director.
Thank you. Thank you, Chair Brennan. Thank you so much for your testimony. I'm going to dig into the upcoming changes of the Office of Neighborhood Safety, transferring the $184 million worth of contracts to the Department of Youth and Community Development, DYCD. As this change is happening in real time, my district is trying to navigate through it, and so I'm sure my colleagues and their respective changes that we want to understand it a little bit better. So just as a background, in the briefing provided on February 8th, the mayor's office announced that the Office of Neighborhood Safety and Gun Violence Prevention, ONS, was moved from Mock J to DYCD. This included a shift of existing staff contract managers, and it was also stated that all contracts will be completely transferred over by July of 2023. Can we talk about why this decision was made to transfer these contracts to another agency, and why is DYCD better equipped to handle this than Mock J?
Now, see, you want me to say better as opposed to why we as one city are making sure that we're balancing efforts and really serving New Yorkers.
Absolutely.
Thank you. So in terms of how we provide the best services to New Yorkers, we are ensuring that our sister agency has not only the people, but the innovation to really focus on how we're building up and serving youth, and how we are building up community development. The Office of Neighborhood Safety houses 3 initiatives. It houses the Office to Prevent Gun Violence, it houses the Mayor's Action Plan, and it houses Atlas. All 3 of those initiatives focus on building strong, healthy neighborhoods, and they also hold the brain power of the individuals who envision what those programs do and continue to envision the evolution of how you build strong neighborhoods. DYCD, as the department that builds youth and builds community, needs and is in a good position to have that innovation and to take it to the next level. We are making sure that we're working together collaboratively as one city. Commissioner Howard, I have his number on speed dial, he has my number on speed dial, that we continue to ensure that the communities get the services that they need with as little bumps in the road as possible as we move into this transition.
Thank you so much for your answer. So we're going to focus on bumps in a little bit because bumps in agency may not be bumps when it comes to the providers and what they're experiencing. So we kind of want you to unpack some of the day-to-day changes for service providers, presumably providers that are working with the same ONS staff, but what are these, the involvement, the interactions will there be between MOCJ and providers? So kind of like talk about what the day-to-day, what it looks like, and how that interaction will be.
So in the short term, the providers should still be dealing with MOCJ procurement folks and contracting folks because they're the ones who understand and can administer the steps that need to happen as our team is getting DYCD's team up to speed. In addition, because of DYCD's internal infrastructure, they have a contracting system that has different budget codes, that has different allocations, and so the FY24 contracts will be built into that infrastructure, and the closing contracts will come off of MOCJ's infrastructure. What the providers will see as a little bit of a difference is that there will be a little bit more structure in how and when they get information into the city. So DYCD has a more structured timeline of getting information in on your invoices, on your contracting documents, on your budget. MOCJ has been a lot more fluid in how providers do that. We are ensuring that we build capacity with all of our partner services to make sure that they internally are ready to meet that challenge, right? So we have our team constantly working with pro bono services and other individuals who are volunteering to do trainings for all of our, specifically when you're looking at the crisis management system, on how they build up their muscle memory for their infrastructure on contracting and the documents so that it won't be such a shock to their system as they move into a much more structured agency.
Thank you so much. So again, thank you for your answer, but as someone who's had to navigate through city contracts and understanding it as it used to be a service provider, it is often not as clear. And from what we're hearing is that this transfer is a bit confusing. So from your perspective, what do you think the challenges will be, and any negative aspects can you foresee of this transfer? And is there a plan in place to troubleshoot? So everything you said was great. It always looks great on paper. And then when that action happens and you're dealing with providers who are really great at programmatic and a lot less great in quarterbacking the operational and the capacity building of the paperwork, government paperwork, which is fantastic, as everybody knows here. How are we kind of foreseeing some of the challenges, and do you foresee some of the challenges, or are we looking at and troubleshooting anything that would be what you would call a bump in the road for this transfer?
In addition to just making sure that both entities, DYCD and MOCJ, stay lockstep, so our teams have individuals that are constantly talking, the partner agencies still have my phone number, and they are not shy at using it. And I am not shy at getting on the phone with Commissioner Howard and vice versa. So we understand that change always brings not only challenges, but things that you never even thought about when you were structuring, this is how we're gonna move forward. And so it is not a matter of the door is closed, thank you, goodbye. It is a matter of we as one city are making this evolution, and as we do the evolution, we will, as one city, continue to work collectively to make sure that we address not only the things that we thought would be challenges, but then address the things that come up as practical challenges.
Thank you so much. I think that you did answer a bit of this question, but I just kind of want to just put a finer point on it. Beyond the collaboration mentioned, are there any specific delineated responsibilities envisioned in each entity? And is there an MOU between two agencies? And if so, what does that entail, and is it something that could be shared?
So we are continuing to work through what the specifics are. There is an MOU for the designation of the work. We also are ensuring that the data that MOCJ uses in order to be able to understand where we need to tweak, right? So when we say that we're a data organization, what we do is we come up with the concept and then we build in the things that tell us whether things are working really well or whether things need to be tweaked. And so in order to make sure that we still have the data to evaluate and understand where things need to be tweaked, we will be the arm that maintains getting that information and helping to do the reports for Office of Neighborhood Safety going forward.
Thank you. Just for a point of clarity, when you talk about the data, is this the programmatic data that's talking about the measurables, that if the program is working?
That is correct.
Thank you so much. I'm going to pass it back to Chair Brannan to see if any of our colleagues have questions. Thank you, Chair Brannan.
Thanks, Chair Hanks. We've also been joined by Councilmember Riley. Now we're going to start with questions. Councilmember Brooks Powers, followed by Brewer.
Thank you, chairs, and thank you for your testimony. I want to talk about contracting. Particularly, a couple have been pretty concerning for me in my district, including Presidential Security Company. Presidential was hired to provide security services by a nonprofit organization, Exodus Transitional Community, which had contracts with MOCJ to assist formerly incarcerated people in the process of reentry. But investigations showed that Exodus of their contract with the city led to the termination of those agreements. Exodus owes Presidential, I believe, almost $2 million for the work performed. And my understanding is that this debt remains outstanding. Also, Sheltering in Arms, which provides a number of services in my district, has been forced to close their doors because of the city's lack of payment. So they were since acquired by, some of their contracts have been taken over by another nonprofit. This is a reflection of a larger issue at MOCJ in terms of payment delays. MOCJ is not ensuring that the organization to which the agency owes money can continue to provide services or make payroll each month. So one, I'd like to know what causes those issues, and two, how does this budget that's being proposed help MOCJ improve its ability to ensure organizations are paid in a timely fashion? And then my last question for you will also be, what is the status of the Far Rockaway Community Justice Center? Thank you.
Good afternoon. I may come back to you and say which one of the questions to make sure that
Gladly.
I answer them all. First, I want to be clear that MOCJ did not contract with Sheltering Arms. That's not a MOCJ partner provider. So
For the Cure Violence Program?
under,
Previously, but it was,
sorry, I'm going to let our chief of staff take that question.
we may have had a contract with them previously, but I don't think that we had one for FY23. But I will double check that for you.
Please do. And then also, as you're checking that, is there an update also on the RFP for the Cure Violence? Is that still with MOCJ as well?
DYCD is completing the RFP currently, and they should be announcing awards shortly.
When you say completing, because I know it closed about over a year ago now.
So the actual application closed about over a year ago, and then there was the evaluation period. So the evaluation period was ongoing, and now they're doing the calculations and completing, and we'll be announcing sometime soon.
You said we'll be announcing?
Sometime soon,
Thank you.
prior to the new fiscal year.
As it relates to Exodus, transitional servicing, and the subcontractor of Exodus, which is presidential that you referred to, we, the city, are committed to ensuring that partner entities that provide services to the city are in fact compensated for the services that they provide. And Mark J's team, as well as the law department and under the leadership of our first deputy mayor, have been working to unwind and resolve payment for services that were rendered to the city. So I am fairly certain that within the last couple of weeks, part of the...
They've received like 1 or 2 payments, and I'm so appreciative of the first deputy mayor for taking this over. But I'm really looking to see it fully resolved, because I looked at my email. I think it's almost 2 years now we've been dealing with this one matter for a small minority-owned business, which hundreds of workers went without being paid. And so one, it hurt the reputation of a reputable Black business, but 2, you had hundreds of workers from across the city that were unable to pay their bills, where people lost their homes for services provided to the city because of the dynamic with Exodus.
Did you want to take it?
We do understand that it caused a significant problem for presidential, and it definitely was not our intention for that to be the case. It is unfortunately a risk for subcontractors that they do unfortunately take on sometimes with contracting providers, but we do understand that it is a serious matter, and we're working with all of our providers to make sure that their subcontractors get paid.
And in this budget, are you putting in any resources to be able to periodically monitor these contracts so that the subs are not left pretty much holding the bag, like they're not getting paid for services rendered? Because for it to amass to $2 million, it's a lot of money that went unpaid for over an extensive period of time. But had there been sufficient oversight, it probably wouldn't have reached so much.
So we are invoiced by the providers, and the providers they're reimbursed essentially. We reimburse them for what they have, they've outlaid. And so when they do that, we receive the invoices, and then we pay based on what they say they have paid. After that, we would really have to hear from the subcontractors in order to know for sure that they were or were not paid. So we do rely on our contractors to make those payments.
And Exodus, do they still have contracts with the city currently?
The Exodus has ATI and reentry contracts, yes.
Even despite owing several subcontractors money?
We continue to work with Exodus in order to ensure that anyone else that they have continues to be paid.
So how do you think this budget is going to help your ability to ensure organizations are paid timely going forward, especially if you're contracting with bad actors? You know, Exodus is not paying their subs.
So we are continuing to work with them to ensure that they do when they invoice. We have a review process with particular providers if there is a concern sometimes, where we look to ensure that their subcontractors are paid when they are paid.
Thank you. I just would encourage the agency to really look at who we are contracting with, because if we see that they're not upholding what they need to do, either we put in something that's a check and balance with that to be able to prevent such massive debt to small businesses and impacting their reputation and their ability to do future work, because you know, you have businesses at risk of closing their doors, but then at the same time, you're telling me that Exodus still has contracts with the city, which to me is unacceptable that the city would do that, knowing that there were challenges, knowing that there was an audit done on Exodus, which resulted in termination of a particular contract, but then you still have other contracts with the city. That doesn't make sense to me, but thank you, chairs.
Councilmember Brewer, followed by Abreu.
Thank you very much. I have a question, and I appreciate your comments about when people leave Rikers, what happens? And here it indicates that the women were given reentry for services 1.08 million that was baselined. So I want to know who gets that money, how does it get utilized? Ditto for the men, what contract agencies you have. We all want people not to go at all. That's a different that's an ATI, but if you are ending up there, it's my experience that there isn't enough support. People still get dropped off at 125th and Lex, et cetera. So I want to know what it is specifically that you're funding, and there may be other agencies that are getting funded to do this, number one. Number two, Councilmember Powers has a bill which I support, and I didn't know your position, that those who have an incarceration record should still be able to get housing, and that's very controversial, but I support it. I wanted to know your position because I think it would help if they could get housing. And then I also wanted to know if you would do something that I also would like to see, whether it's upstate or New York City, instead of going to the shelter, which is where a lot of people go, that I don't care whether it is Osborne, Fortune, et cetera, all these reentry beds should be provided funding for them and not for DHS, only because DHS can't handle it. And if we want to prevent recidivism, Fortune, Osborne, et cetera, are other groups to do it. So those are my questions. It's mostly about how do we keep people from returning? And who's paying for it and how much?
Thank you for that question. We are committed to making sure that people are given the foundation to move forward. I am going to let our chief of...
Okay, I don't mind that answer, but that's too general for me.
No, I'm going to let our chief of staff go ahead and give you...
I'm not too
very
good on
specifics.
rhetoric.
All right, so our reentry services providers are funded at about $26 million, and they do provide in-custody services in order to connect folks to services once they leave. We can't deny that there are sometimes gaps because sometimes people are released unexpectedly, but they do work very hard to try to make that connection prior to people leaving.
Okay, so
and if you are aware of individual cases, we would strongly encourage you to refer them to either Fortune or Osborne or to us so that we can make sure that people get connected to services.
So who is funded at the 26 million? And is it just MOCJ? Is there any other agency also supposedly helping people before they end up on the street?
I believe that DOC does have some discharge planning within jails, and then our folks work on the connection to the outside world.
Okay, so who gets the 26 million? Is it broken up to different nonprofits?
It is. We have a total of 10 providers.
All right, you could get us that list, doesn't have to
We
be
can
right
send you
now.
the list.
Okay.
Okay.
And then who does the evaluation? Is it done by a university to see if it really works, or is it done just by self-reporting? I'm a big believer in evaluation and not by the agency.
Agreed. It is currently done by self-reporting and monitoring, but we are very much interested in evaluation as well.
Well,
That is something
very much interested translates to what?
that translates to we should be conducting an evaluation in the next year or so.
When we say we, would that be like a CUNY,
No,
Columbia, NYU, et cetera?
An independent evaluation.
Okay. And then my other question would be housing for the future. In other words, I've got the Powers bill. What's your position on that? I don't know the number, but you know what I'm talking about. And then also, do you support getting funding for Fortune, Osborne, anybody except DHS when people leave either upstate or Rikers?
So we currently fund Osborne to do discharge planning upstate so they do some in custody, and then they provide transportation as well. In addition, we also have transitional housing where folks can be assigned to a transitional housing space when they're leaving jail or prison, and that includes from upstate. And we are currently working to expand that program.
Okay, but expand it a lot, because you've got about 2,500 people coming upstate every year to shelter, and I don't know, in the hundreds get housing. I'm talking about thousands of units. We need to move from DHS to any of the other providers who actually know what they're doing.
So DHS is, I know that they have done a lot of work on their reentry.
There's no way in the world they can handle this population. They don't.
So I will not speak on the city sister agency. I know that they're doing a lot of work on it, and they're really looking to evaluate it and see what they can do around the population.
Okay.
We do currently have transitional housing because there is an outstanding need, as we're aware. And we are always looking for ways and working with our other city partners to.
I won't
make sure
belittle it here, but I am telling you, you should be advocating to get the folks out of DHS and into housing that is run by these nonprofits to actually know what they're doing for this population.
We're absolutely advocating for all appropriate spaces.
Thank you.
For folks who are leaving.
Okay, we've also been joined by Councilmember Farias and Kagan, and we now have questions from Abreu, followed by Schulman.
Thank you, Chairs. The Daily News reported on April 24, 2023, that from 2017 through 2021, some 93% of the 12,910 guns recovered from crimes in the 5 boroughs were linked to an initial sale from out of the state, according to data from the Federal Bureau of Alcohol, Tobacco, Firearms, and Explosives. To help combat this scourge of illegal firearms making their way to the city, and to find innovative solutions in cooperation with our state and federal partners, I sponsored Local Law 90 of 22, which was enacted on October 11, 2022. This law mandates that MOCJ, in coordination with the NYPD, conduct a study and issue an annual report to the mayor and city council speaker on the trafficking of illegal firearms into New York City. The report was due December 1st, 2022. It is now 167 days since the report was due. My question is simple. Could you please state for the record, where is the report and when will I receive it to read your findings?
Thank you for the question. We are very much aware of the delinquent report. We have a draft of it, and we've incorporated data from the NYPD and input from our sister agencies, NYPD included. We should be able to issue that report within the next month to 6 weeks. We have been working on it, I assure you. And our goal is to use this experience of doing this report for the first time to ensure that the following year's report, which is due this coming December, will be issued on time.
Thank you.
Councilmember Schulman, followed by Sanchez.
Thank you. Good afternoon, all. So I have a question. So I know that MOCJ is like the umbrella for the city's criminal justice system. So, so discharge planning that's done for people coming out of Rikers, does that come through you? I know it goes to the other agencies, but do you kind of oversee that?
So our providers do provide discharge planning for folks coming out of Rikers, yes.
So this week, some of the community-based organizations, including Fortune Society, were told that the contracts were going to be ended on June 30th for discharge planning, and that was going to be taken in to the Department of Corrections, and I want to know what was the reasoning behind that.
So thank you for the question. The discharge planning that MOCJ contracts with will continue.
Okay.
So with our partner providers. The Department of Correction provided an additional layer of discharge planning internal to the Department of Correction through their own contracts, and they are moving forward with internalizing that work stream within their own agency.
Do you have oversight of that, or they just do? That's separate?
That is internal to the Department of Corrections agency, and they would have to be the ones to speak on
Because if we're
that.
talking about, piggybacking on Councilwoman Brewer's questions, I mean, if we want to keep people from recidivism, and we want to make sure that people have the best chances in terms of returning to life outside of incarceration, we really need to have a cohesive system where people who are receiving benefits from community-based organizations which do a wonderful job. I've personally worked with the Fortune Society, have that opportunity, and so this is something that is very important to me and I think other members of the council.
Understood and appreciate the question. We have worked very closely with our sister agency to make sure that people are connected. So the Department of Correction had its own internal programming. We continue to maintain the programming for reentry services. They will be available for the Department of Correction to refer to the programming that MOCJ contracts with for individuals that need to be connected. So if the Department of Correction is internalizing that work, they still will have the ability to refer to programming that is contracted by MOCJ.
No, and I appreciate what you're explaining to me on the process level, but I will tell you that a lot of these organizations actually have people working for them that are formerly incarcerated, that are going to be out of work, and also they're the best ones to deal with people in the system. So I want to say that. I also want to ask on a different level, reentry services for women. Can I just finish my line? Thank you. Reentry services for women was given a $1.8 million in FY24 that was baselined in the out years. Please explain how many women are currently being served by holistic reentry services for women.
Thank you for the question. I'm going to let our Chief of Staff, Nora Daniels, go and give you the specific numbers.
About 35% of folks being served by reentry services are women currently.
And how many women who use these services remain outside of the criminal justice system, and what are the recidivism rates?
In general, I am not sure about the specific recidivism rates for women, but I can check on that and I can get back to you.
Okay, and my last question is, in addition to reentry services for women, what other programs do you offer for women who are involved in the criminal justice system?
We offer ATI programs for women, and we also have the Abusive Partner Intervention Program.
Okay, thank you very much.
Councilmember Sanchez, followed by Holden.
Thank you so much, Chair. So I was also going to ask about JISH, Justice Impaired Supportive Housing Initiative, but Councilmember Brewer and Councilmember Schulman have both asked about it, so I'll just make the statement that, you know, there was a commitment in the Rikers point of agreement to expand this program. So the council, as was stated in our budget response, we really do want to see an expansion of the JISH program. So I'll focus my question on the Office of Special Enforcement within MOCJ. Which, as you stated in your testimony, brings together DOB, FDNY, and legal resources to protect the housing stock in the city of New York, and of course is a key enforcer against illegal short-term rentals. So given that there are some new regulatory requirements that are going to be coming into effect, and enforcement is going to be particularly important at this juncture, can you share what exactly is OSC's budget? And given that there's inspectors from different agencies and things like that, do you have information about how many inspectors from FDNY and from DOB are dedicated to this work?
Thank you for the question. I just want to make sure I have in front of me Office of Special Enforcement's specific budget. So for fiscal year 23, Office of Special Enforcement was budgeted at approximately $6 million. Their authorized head count is 29. And they have, let's go back to their inspectors. I'm going to revise that. Their actual head count is 60 individuals. They have approximately 32 lines available to fill, and they're in the process of onboarding. Their process is a little bit elongated because building inspectors and fire individuals are on a civil service line, and so we have to work with the department, with DCAS, in order to make sure that we pull and call lists for individuals to fill those vacancies, and we have been working with DCAS to ensure that the interviewing and the process that has to happen for pulled lists is followed to the letter.
So a 50% vacancy rate at the Office of Special Enforcement?
That is correct.
Okay, that is extremely alarming, and I look forward to having more conversation on that. just because I'm on the mic and I just did this, I'm a lactating mother and very proud of the amount of milk I produced. So big ups to lactating moms everywhere. Our plights are not often discussed, so I'll take the moment. Thank you, Chair.
I take full credit. I now want to have questions from Holden, followed by Williams.
Thank you, Chairs. Thank you for your testimony. A couple of questions on, Mark J. has budgeted, it says in your testimony, $600 million in human services contracts. And you break it down, supervised release, $67 million, ATI, $34 million, and Community Justice Reentry Network, CJRN, $26 million. I hear that you're serving, let's just take ATI, Alternatives to Incarceration. You're serving 5,660 people, to be exact. How are we measuring success in that area? Because that's an important area.
Agreed. It's incredibly important for folks who are assigned or mandated to ATIs to have the supports that they need, and we absolutely do not want people to recidivate while they're on the programs.
But do you have any stats?
We do, yeah.
Okay.
About 85% of folks who are on ATIs complete the ATIs, and about 77% of folks are not rearrested for a new crime, and 97% are not arrested again for a violent felony.
So with all these programs, supervised release, $67 million. Within those, and all, ATI, and also the Community Justice Reentry Network, these are all, and it's totaling well over, let's say, $140 million. What program do you consider the best program within those that shows the best numbers? Because in your testimony today, I didn't really hear outcomes. We're not getting that in the testimony, essentially. So what would you say we should invest more in? And then what are some of the programs that are not, the outcomes aren't so great? So that as a body here, we could actually come up with and help with a budget that makes sense. But this is why we're here.
So thank you for that. We have been working with our data teams to review the places where we could strengthen programming. I'm going to let our Deputy Director of Policy kind of walk through some of the areas that we have focused on.
I'll speak for a moment about our supervised release program, which in recent years has grown dramatically and really achieved good levels of success. I will just add as a preliminary note that I think many of the programs that we operate are complementary to one another, and they're serving different pieces of the puzzle. So they're not necessarily overlapping and sort of able to be compared one against the other in certain ways. The supervised release program in fiscal 19 was serving under 5,000 people per year. So far in fiscal 23, it looks like we're going to have over 20,000, maybe over 22,000 total served, which is about a 4 to 5 time increase over the past 4 or 5 years. So a huge increase. I think a lot of credit is due to the contractors. We now have 4 contractors working across the city to ensure proper supervision and support for individuals who are released pre-trial. In terms of outcomes, in the supervised release program in the last fiscal year, we saw 89% of individuals who went through the program complete their term of supervision without failure to appear and a warrant issued. So we consider that to be a very successful outcome as a general matter. And then in addition, we saw a rate of 72% complete their period of supervision with no rearrest, whether misdemeanor or felony.
You said 72?
72%.
Okay. But on the other side, just one other follow-up on that, Chair, if I may. What programs aren't working that you feel we need to re-examine and maybe rethink?
Well, so I don't know that we would say that it's not working. I know that within the population that supervised release is serving, there is a core group of individuals that we know are not getting the intensive case management that they need. And those are the people that we see when Mayor Adams is talking about the people who are coming back on recurring criminal charges. There's approximately 9,000.
But I want a red flag. Like, I want a program that you feel we need to re-examine, because we're putting money into it, but we're not really seeing the impact that we expected.
Well, but that is your red flag.
That
is your red flag, because what it is that it was the program was designed for people who did not need that type of high intensity case management, and therefore that 9,000 bucket of population are not getting what they need. And so that would be where we would be saying we need to go back and drill down and figure out what the specific additions are for those individuals that fall into that 9,000, because we know approximately 2,000 of those 9,000 people come back on a violent felony offense. And that's where we as a city need to make sure that we're putting resources and supporting.
Thank you. Thank you.
Councilmember Williams, followed by Areola.
Hello. I just have a quick question about staffing. Overall, how many vacancies does MOCJ have? You asked that question?
I would get our Chief Operating Officer to go over our full head count.
We currently have 69 vacancies at MOCJ.
How many?
69?
69 vacancies.
Yes.
So is it fair to say that you're like 50% down? More than 50% down?
Approximately 40% down.
40% down. Okay. Can you just share what reductions, what were the reductions in the head count and your ability to fulfill any requirements of your department?
Sure. In prelim, there were 3 reductions. We are able to meet our requirements on the procurement and fiscal side because we have a dedicated team of professionals that get the work done. And as previously mentioned, we do have 2 staffers being onboarded in about a week and a half to ensure that we are able to meet our targets.
Are you being allowed to hire for the rest of the vacancies you have?
Yes.
Okay. Is that a part of the overall plan the city has been initiating? So has MOCJ been a part of like the job fairs and?
Absolutely, absolutely. We do have a liaison on the Talent and Workforce Development Task Force, and we have been proactive in our own outreach to fraternal organizations, professional membership organizations, and working with our sister agencies to ensure that we are recruiting as best possible.
Okay, and another question that I have is not about that. It's about bail reform. And I know there's been a lot of conversations about supervised release, and some of those things are intertwined. And so given a lot of the conversations around bail reform, has MOCJ made any assessments in terms of the impact, things that we as a city can do to address some of the concerns that people have? And to essentially expand supervised release to be a more robust program than what it originally intended to be, given new reforms to bail?
Thank you for the question. We have indeed been looking at the anticipated outcomes and impacts of the changes to the bail laws that were included in the state budget process. Our preliminary assessment, which we continue to update based on data that's coming in and input from our partners, is that we do not anticipate a significant increase in the jail population in New York City. However, we do believe there may be some increase in the pretrial release population, related in many ways to the provision that you just described related to supervised release. In particular, in the bail laws, the change relates to judges being authorized to order supervised release as a backstop to bail payment. We have been in touch, and we continue to be in touch with our partners at OMB about potential changes needed to supervised release funding and other changes to our programs that may be needed as we see more changes in the population.
Yeah, I was in a session, and the folks who do supervised release made a lot of claims that they don't have the capacity to deal with folks who are out on bail. And it's not that bail reform is a terrible thing, it's just that folks are not being properly supervised because the supervised release program never had the capacity to monitor as many people that they then have to monitor through bail reform. So it's important. I hope you do. OMB does give you the flexibility to be able to scale up that program if you are seeing an increase in individuals who are in need of supervision.
Thank you. We are working through that in addition to addressing the fact that those partner providers have seen individuals staying under their management and monitoring far longer as we're coming out of the public health crisis. People stayed on longer than anticipated when the program was enacted because nobody actually ever thought about COVID when they were thinking about how long cases would take.
Okay, and just one very quick thing, chairs, about the CMS system. I know you guys know that I'm like very passionate about the CMS system, and I know that they're under DYCD, which I don't fully agree with. Just want to go on the record to say that. I know you have to say what you have to say, but I don't fully necessarily agree with them being moved into DYCD. But what exactly is going to be MOCJ's continuing role in CMS, whether it's providing some type of feedback on the type of work that they're doing? We passed a bill that essentially requires levels of accountability and reporting on efficiency of the programs. And so is MOCJ going to be doing that? Is DYCD going to be doing that? Is it a joint effort? And last but not least, and I'll be quiet, thank you so much, chairs. Yesterday, I actually, was talking to a mayor in Detroit, and one of the things that they do is essentially they have these programs where it's they give $1 million, and if they're actually able to come back with data to show, okay, this amount of shootings didn't happen in a community, they will increase the funding. So it's metrics based, and I think that was the goal of the bills that we passed in the Public Safety Committee. So really trying to understand where this type of work will fall given the transitions of CMS into DYCD, which I do not think DYCD has the expertise to provide this type of oversight and metrics-based performance.
Thank you for that very robust statement. I do hear you on the work that needs to be done. And as I've said, it is one city, and we are going to be working collectively to MOCJ reviewing data. We're working with our deputy mayor. We fall under Deputy Mayor Banks, who has a quality assurance role. So we have sat down and we've started talking about what key performance indicators should look like and starting to make sure that those measures will be incorporated going into the future contracts for the awards of who's going to be getting the work in different areas. In addition, we do have a federal CIPRA grant, which is about the pay for performance, right? So it is a matter of measuring how many shootings have been reduced in an area that is a catchment and how many hospital beds haven't been taken up. And so we're doing that work now, and we hope to be able to finish producing those reports so that we can give much more robust information. But hearing you and understanding that, again, same as Councilmember Holden said, that when you invest your dollars, you want to know what that dollar gets you. And so we too, the mayor is extremely committed in making sure that not only we, MOCJ, his arm of data research think tank, does that, but all of our sister agencies are doing that. So collectively across the city, we're working to make sure that we are giving not only our mayor that information, but you as well.
Okay, now we have Councilmember Ariola.
Thank you, chairs. In your conversations, earlier in your testimony, you said that you are in conversations with OMB with respect to the disbursement of the state funds. Are you addressing the inequities in the amount of funding that's given to some district attorneys? Is consideration being given to crime stats with each borough when earmarking the funding? And as an example, the Queens District Attorney's Office currently receives the least amount of funding compared to other boroughs, yet has one of the largest volumes of criminal cases.
Thank you for the question. I would have to go back and review just what the full breakdown is among the 5 district attorney's office, and then the special narcotics prosecutor. I did not, my memory wasn't that they received the least amount of funding, because Staten Island by volume also is a lesser amount. However, when the distribution of funding is done, it is done based on case volume as well as the needs that each individual office puts into the Office of Management and Budgets, and then Management and Budget will look and have conversations with MOCJ about how those meet the initiatives and goals for the city as a whole and the places where things need to be strengthened. I know that one of the issues when we were talking about different budgets was when you're looking at the Bronx, the fact that they have the jurisdiction that is Rikers Island, the case volume that's there, in addition to the case volume that is happening within their borough as a specific measure. So we are happy to go back and look at like the specific Queens DA funding to see what, if anything, needs to be addressed there. And we will always work with all of our partner DAs to make sure that they have the resources that they need.
I appreciate that, because when the DAs did come and testify before us and the documentation that was given, it was, Queens was at the lowest. Even with Staten Island being a smaller borough, Queens was still given the least funding. So I would appreciate you getting back to us with that. Thank you.
Absolutely.
Okay, now we have Councilmember Brewer.
Thank you. The Queens DA called me too, so you should definitely call her. She's quite adamant about it, whatever. I have a question. Yesterday, it was in the paper, correction, not you, cut Fortune, their contract that helps people leave Rikers by $17 million. So my question to you is, did you have any say about that? Does that impact, do your groups have to pick that up? Obviously, they're doing probably some classes at the facility, which is not you, but I assume they're doing reentry also. I'm really concerned about reentry, obviously. And so my question is, did you know about this cut? Do you support this cut? Can your agency pick up whatever Fortune was doing in terms of reentry? Are you aware of the cut, et cetera?
The Department of Correction made the determination to figure out closing their budget gaps via whatever the vehicles that they thought they would be able to assume the work in-house. We as a city are making sure that as we look at the services, we address the gaps. At this juncture, we are making sure that we are maintaining the reentry services. We're maintaining a relationship with the Department of Correction to ensure that people get the referral to the services in community. As we continue to evaluate whether or not there are gaps in those services, we will be going back to all of the partners to talk about whether or not there needs to be additional supplement in order to address what the result may be of the Department of Correction internalizing a lot of the work that they...
Okay, I mean, I hear what you're saying. I guess what I would like to know, not now, is exactly what the reentry projects that Fortune did are, and who is picking them up. If nobody is, maybe they're not needed. I don't believe that, and I don't know that correction can do the same kind of classes. I understand PEGs, blah, 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 but this would not be something that I would have cut. So I would like to know, in addition to the 10 groups that are doing it for you, I'd like to know what, and we can, you could get this from correction just as easily. We'll certainly ask it when they come before us, but what is it that Fortune was doing and who's gonna pick it up? I assume it was worthwhile, because everything Fortune does, in my opinion, is worthwhile. Thank you.
Thank you.
Thank you so much. Thank you, Deanna Logan. Thank you, Chair Brennan, and all my colleagues that have attended this hearing today. My closing statement, I just want to reiterate some of the questions of my colleagues when it comes to data and really looking at, what are the results of the hard work that my colleagues are doing in putting forth these bills, these reporting bills, and that we should be doing a much better job in getting the data and the information that we're asking for so we actually know if we're winning, whether we need to adjust. And I appreciate all the work that you're doing, and thank you so much for your testimony today and your answers to our questions. Thank you, Chair Brennan.
Thank you, Chair. Thank you guys so much. We look forward to working with you over the next month and a half as we negotiate the budget.
Thank you. Look forward to working with you as well.
Okay, we'll take a little break, or no? We're going to take a short break, and then we're going to hear from FDNY. Thank you.
Once again, if everyone can find their seat, we're ready to resume.
Okay, good afternoon. We're ready to begin the second and last hearing of the day. This is day 7 of executive budget hearings, and we're going to be focused on the Fire Department of New York and Emergency Medical Service. Pleased to be joined by my co-chair for this hearing, Councilmember Joanne Ariola, Chair of the Committee on Fire and Emergency Management. We've been, we've been joined by Councilmembers Kagan, Riley, Schulman, Feliz, Carr, and Yeager. Welcome, Commissioner Kavanaugh and your team. Thank you all for joining us today to answer our questions. I'm just going to set the table. On April 26, 2023, the administration released the Executive Financial Plan for FY23 to 27 with a proposed FY24 budget of $106.7 billion. FDNY's proposed FY24 budget of $2.3 billion represents 2.15% of the administration's proposed FY24 budget in the executive plan. This is an increase of $55 million, or 2.5%, from the $2.24 billion originally allocated in the FY24 preliminary plan. This net increase is mostly due to the Be Heard expansion, additional overtime funding, and increased revenue from the emergency management service. My questions will largely focus on fire inspectors, the overtime budget, the FDNY revenue sources, including EMS. I have to point out that the last two issues go directly to something I've been speaking about for years. For decades, I believe that the city has treated the fifth firefighter as optional at best or unnecessary at worst. And I believe this is misguided in the name of cutting costs. Now we look at overtime numbers, it's not even accomplishing that. Separate from this, it's frustrating to me that the executive plan will count increased revenue generated by EMS for the budget, yet those EMS workers who answer those calls, go on those runs, remain the least compensated of all our first responders. I believe they're in need of pay parity with their counterparts. I don't think there should be any second-class first responders in our city. I look forward to discussing this and more with the department, but I'm now going to turn to my co-chair for this hearing, Councilmember Ariola, for her opening statement.
Thank you, Chair. Good afternoon and welcome to fiscal 2023 executive budget hearing for the Fire and Emergency Management Department of New York. My name is Joanne Ariola, and I am the chair of the Fire and Emergency Management Committee. Today, we will review the Fire Department's fiscal 2023 budget to understand how it addresses the needs of all New Yorkers. Today, we are here to discuss the Fire Department's fiscal 2023 executive budget, which is $2.3 billion, with 17,329 positions. The fiscal 2023 executive budget has undergone some changes, increasing $5 million since adoption. The department has 5 new needs in fiscal 2023, totaling $48 million, which are entirely city-funded. The Fire Department's fiscal 2023 to 2027 capital commitment plan totals $1.5 billion and supports 299 distinct projects. Following a productive conversation around the preliminary budget and some significant budgetary changes for the department in the past 2 plans, I'm looking forward to discussing the Fire Department's priorities, needs, and recent actions. The department has added funding for the Behavioral Health Emergency Assistance Response Division, Be Heard. Increased ambulance tours, and the committee and myself would like to understand some of these changes. I would also like to discuss lithium-ion battery fires, diversity, recruitment, and more. I'm excited for what we will accomplish over the term and look to build on previous hearings we have had in the past few months about diversity and, as always, the safety of FDNY members. I would like to thank our committee staff for their hard work, financial analyst Tanvir Singh, unit head Jack Story, committee counsel Josh Kingsley, political analyst Will Hongash, and my chief of staff Phyllis Incerillo. I would like to welcome and thank Commissioner Kavanaugh and our firefighters, EMTs, paramedics, and the department's civilian staff for the work that they do, and I'm looking forward to hearing from the Commissioner, and I would like to recognize, we've already recognized our colleagues, right? Yes. Good. Well, I will now turn it back to committee counsel.
Good afternoon. If you raise your right hands, please. Do you affirm that your testimony will be truthful to the best of your knowledge, information, and belief, and you will honestly and faithfully answer councilmember questions? Commissioner Kavanaugh? Chief Hudgens? Chief Fields? First Deputy Commissioner Pfeiffer? Deputy Commissioner Kristoff? Assistant Commissioner Noonan. Thank you. You may begin.
Thank you. Good afternoon, Chair Ariola, Chair Brannon, and all the council members present. My name is Laura Kavanaugh. I am the Commissioner of the New York City Fire Department. I am joined today by Joe Pfeiffer, First Deputy Commissioner, Jack Hodgins, Chief of Department, Michael Fields, Chief of EMS, Lizette Kristoff, Deputy Commissioner for Management and Budget, and Nafisa Noonan, Assistant Commissioner for Recruitment and Retention. Thank you for the opportunity to speak with you today about the executive budget for the Fire Department. Before I address the budget, I'd like to acknowledge two special members of the FDNY family and an act of heroism that took place since we last spoke. Cesar Reyes and Elijah Houston are seniors at the FDNY Captain Vernon A. Richard High School. While walking to school a few weeks ago, they stopped by a friend's house and encountered the friend's father on the kitchen floor, unresponsive and gasping for air. Cesar had taken an FDNY prep course as part of his school curriculum, so he knew what to do and he sprang into action. Finding no pulse, he immediately called 911 and began performing chest compressions. Elijah guided the responding EMTs and paramedics into the house and talked the family through the situation, keeping them calm. Together, Cesar and Elijah saved the life of their friend's father. In our preliminary budget hearing, I highlighted the work of FDNY's mobile CPR outreach unit. The situation that Cesar and Elijah found themselves in shows just how valuable it is to know CPR. Being prepared may enable you to save the life of a stranger or a loved one. The department offers free CPR courses in multiple languages, and we encourage everyone here to enroll. I am also pleased to report that today, right now, 3 FDNY firefighters are being honored by President Biden at the White House for acts of heroism. Retired Lieutenant Jason Hickey, Lieutenant Justin Hespeler, and firefighter Patrick Thornton each received the Medal of Valor this morning in connection with acts of heroism involving, respectively, a rescue of an individual in the Harlem River, a rescue of a newborn baby from a fire, and a rescue of an individual who was trapped beneath a capsized boat. Every day, our FDNY members make us proud, putting their lives on the line for New Yorkers. The executive budget for fiscal year 24 is a reflection of Mayor Adams' ongoing support for public safety. Among new needs, it provides nearly $27 million in funding for FDNY's role in the Behavioral Health Emergency Assistance Response Division, or BHERD program. BHERD pairs FDNY EMTs and paramedics with mental health professionals to respond to mental health calls that come through the 911 system. These teams respond to a wide range of behavioral health problems, such as suicidal ideation, substance misuse, and mental health conditions, including serious mental illness. Team members bring significant experience with mental health crisis and have undergone joint training to respond to and de-escalate emergency situations. This budget funds the program's operations in existing areas and an expansion to an additional high-needs neighborhoods. It also includes funding for 2 basic life support ambulance tours that the department is absorbing that were previously operated by Kingsbrook Jewish Hospital in Brooklyn. Other funding in the executive budget covers personnel services and other than personnel services adjustments for FY23, including funding to support updated spending projections for uniform overtime spending, as well as auto parts and telecommunications service cuts. The executive budget reflects the fire department's steps to meet obligations under the program to eliminate the gap, or PEG. These measures include decreased contractual spending and additional Medicare revenue generated by EMS transports. I will close by addressing a topic that is the top focus of the fire department and the council and the chair. The trend of fires caused by lithium-ion batteries continues to wreak havoc on our city. This past week, the number of deaths caused by these fires in 2023 surpassed the total number of deaths caused by lithium-ion battery fires in 2022. We are still encountering residents leaving unintended batteries to charge overnight, batteries in vehicles left blocking their only way of egress, and locations where large number of batteries are present. We continue to see fires resulting from micromobility devices, and we are engaged in a comprehensive information campaign to warn New Yorkers about the dangers of these fires and best practices to stay safe. As a city and as a department, we are attacking this problem at every level, from Mayor Adams' Charge Safe, Ride Safe electric mobility action plan, to working with the state and local representatives, members of Congress, and an ongoing dialogue and engagement with the Federal Consumer Product Safety Commission. These efforts will be effective over time, but we know that there are unsafe devices in the hands of our citizens right now, so we are doing everything we can to mitigate potential dangers. We have developed and released new public service announcements and safety materials. We continue amplifying our outreach to the community. Many of you have shared those messages, and we thank the Council for your efforts and cooperation in helping to spread the word. Working together, we can make a difference on this critical threat. I'd be happy to take your questions at this time.
Thank you, Commissioner. I want to talk about overtime. The fire department has always been one of the agencies that uses the most overtime. It's often required to perform the job, with calls coming in later in a shift and responses obviously requiring longer hours or to maintain staffing levels. One question we have is, I know this fiscal year the department has loosened its overtime cap. And according to the executive plan, FDNY anticipates spending 67% more than what was budgeted at adoption. That's compared to 60% more than what the NYPD is budgeted for overtime. So could you tell us why has overtime increased so much compared to an agency like NYPD that's much larger?
Sure. So there's a couple reasons. One is, we have fixed post staffing, which means minimum manning. So, we can't staff a fire company with less than a certain number of members. And so that requires us to use overtime to fill those gaps. And the reason that we are short in headcount and have those gaps is a direct result of COVID. So classes were not put in for a number of months during COVID, and we're working to catch up now. We're getting creative in how to, fit in more classes and make sure that we do get to headcount so that we see that overtime decrease eventually. I'd also like to mention that that cap is not related to our overall spending, but is related to how overtime is allocated among members and is a health and safety issue, which is why we raised that cap in order to address the very high number of overtime hours some members were working. Anything else?
What was the most recent class?
As in how large was it?
Yeah.
Or when? It was put in a few weeks ago, and it was a little over 300. Do you know the exact number?
With 327.
327.
Okay. Now, what's the average?
That is about the average that we put in, yeah.
Okay, talk about revenue. FY24 budget included $650 million of revenue in FY23, which was an increase of $20 million compared to the preliminary budget. It includes many sources such as federal and state grants, but a large portion comes from EMS revenue. What factors contributed to FDNY's increase in projected revenue compared to last year?
Commissioner Kristoff?
Sure. So in the executive budget, one of the EMS revenue increases that you see is tied to Medicare revenue. So the Centers for Medicaid and Medicare Services had authorized increases to their rates as of January of 2023, and so it's really reflecting that increase in the Medicare rates.
Was it so it was anticipated or was it unexpected?
There's normally an adjustment every year, though the exact amount of the adjustment isn't necessarily known in advance.
Okay. During our last preliminary budget hearing, the department hired a new class of inspectors to fill the shortage. Being that this is a revenue-generating position, would it be fair to say that that would increase revenue?
That should certainly have a positive impact on revenue once they're out in the field. Those inspectors are currently in training, but they should be graduating soon.
And did the increase in projected revenue take into account the increased EMS runs from the Be Heard expansion?
So we don't actually see an increase in overall runs tied to Be Heard. Like, those were calls that we were responding to previously, but it is a change in the kind of response that's being sent.
Okay. Okay, let's talk about the 5th firefighter. It's a big issue for me. 2011, Mayor Bloomberg removed the 5th firefighter from every company, instead requiring that 2 engine companies of 4 firefighters respond to each call. And there's been a lot of discussion around if the demand for firefighters is greater during the cold months versus the hot months, whatever. Would the addition of another firefighter help during these busy times, these busy peaks?
So as you know, the 5th firefighter is related to, it's a collective bargaining issue. We do, in certain circumstances, and I'll let the chief expand on this, add the 5th firefighter in certain weather conditions and other conditions where it's required. Chief?
In certain conditions, we do add the 5th firefighter. Usually it is because of like a deep snow, because the firefighter stretched the hose line, and it does require, if there's a lot of snow, it gets caught on objects. It's harder to walk through the snow. So that is a place where we really could use it. As far as other weather-related issues, we do evaluate each one. Sometimes if there's serious flooding or expected or hurricane-type weather, we may add the 5th firefighter. But the one constant is when we have deep snow, we always add the 5th firefighter.
Understanding it's part of a collective bargaining, would the department work with the union to prioritize bringing back the 5th firefighter?
We would, like we said, it is part of the collective bargaining process, so we would have to, go to the table and talk about it.
Do we have enough firefighters to implement the 5th firefighter when we need it?
Yes, the 5th firefighter in those circumstances is hired on overtime. So it's in addition to our regular staffing.
All right, let's talk about EMS pay parity. This year, we've seen the importance of our EMS members, both paramedics and EMTs. However, their wages continue to lag behind other first responders in the city. Could you tell us the current attrition rate for EMS?
What's that? So the current attrition rate is about 8.9%.
What are the current challenges in achieving pay parity for EMS?
So just like the 5th firefighter, it is a collective bargaining issue. As I think you know, I have a pretty long track record of advocating for this with you, and we did get a substantial raise for our EMS workers in the last contract, and we will bring that advocacy to the table again.
Do we think some of that extra EMS revenue could be put towards pay parity?
I think that's something we'd have to talk about in collective bargaining, but I would say we will look at every avenue to support our workforce.
When are those contract negotiations going to take place?
So we don't know the exact dates, but given that DC 37, which is the parent union of our EMS locals, has settled, we can anticipate that they'll be soon.
Okay, I'm going to turn to Chair Ariola. Thank you.
Thank you, Chair. Commissioner, in your opening statement, you mentioned the great honor that Lieutenant Jason Hickey received today. He's one of the officers that we're looking to have reinstated. We're proud of him and proud to know him, so thank you for mentioning him.
Of course.
I want to talk about lithium-ion batteries, my favorite topic. To learn about the FDI, the ongoing lithium-ion battery fire crisis is one of the city's one that the city must work together to mitigate. I'm happy that the FDNY and the council are on the same page on this issue. During our preliminary budget hearing, the FDNY mentioned how serious the problem actually is and that action is needed, and it's needed now. What is the FDNY stance on Intro 949, which would create a citywide buyback program for the kind of defective or uncertified lithium-ion batteries that have sparked dozens of fires?
So I would say that the FDNY would support any program that got these unregulated bikes out of the city and out of people's homes. That includes both regulation, an ability to make sure that people who currently have bikes, to your point, or have a safe battery is incredibly important to us.
Okay, great. And does the FDNY have any idea of the cost associated with this legislation?
I am not sure, but we are working with a number of city agencies as well as the delivery companies to figure out both the costs and how those would be borne outside of the delivery workers who should not bear the cost for that.
Right, I know that the FDNY has worked with food delivery companies recently to promote a campaign of teaching people about the dangers of lithium-ion batteries that are not certified. And $300,000 will help. $300,000 that will help fund public education campaign to teach and educate New York e-bike drivers about the dangers of knockoff lithium-ion batteries. Can you give a brief description about the educational campaign?
Sure. So we're trying to educate in every realm possible and certainly working with many of you. And we are also open to additional ideas that work in your local communities. So that's everything from the PSAs, which I think some of you have seen, to working with local clergy members, working with deliveristas, working with all the elected officials in a district to get out as much information as possible, in some cases even going door to door. So really doing whatever it takes to let New Yorkers know that they may have a dangerous device in their home and not realize it.
And do you foresee more partnerships with food delivery companies?
Absolutely. I think we have to do everything we can until this problem has, been tackled. I think that the legislation we've supported on the city, state, and federal level will ensure that these devices are regulated, and eventually we will see only safe devices coming into the city. But the danger we have is right now people have the unregulated devices in their home, and so until that danger is mitigated, both to New Yorkers but also to first responders, we have to keep doing everything we can.
And how does the FDNY address enforcement of this, of if they do find situations where there are non-certified or bootleg batteries that are dangerous?
Yeah, we have, working with our fire marshals and the Bureau of Fire Prevention, we have done a number of investigations and sweeps. We also are seeing that the number of complaints coming into 311 has gone up, which means New Yorkers are beginning to become aware of the danger of some of these pictures you've seen where there's dozens or hundreds of unregulated batteries or bikes being charged in a single location. So, we're pairing enforcement with education, with hopefully incentives to help people be able to afford a safe device.
Great, thank you. 2 months ago, the Be Heard rolled out its biggest expansion so far, marking its first foray into Queens and giving it a presence in every borough but Staten Island. Its 3-person teams now respond to emergencies in 25 police precincts across the city. This expansion comes in the form of a baseline funding of $27 million in FY24 and the out years. And the head count right now, a head count increase of 64. During our last preliminary budget hearing, the commissioner stated, contrary to the media consensus, the Be Heard unit is performing to the metric that the FDNY is holding them to. Can you please describe the metrics that the FDNY holds Be Heard to?
So there are a number of metrics we look at, but the biggest one is whether or not people are getting continued care and don't need to come back into an emergency system. So, that's the metric we're always looking at. Can we actually get people with serious mental illness into long-term care such that they can be, more safe for themselves, for their neighbors, and eventually won't require a 911 response to their mental health emergency?
Right. But Be Heard is struggling to get staffing, is that correct?
There are issues that are both national and citywide. They're not unique to the fire department with social workers. So getting social workers has been difficult, but we continue to get creative and try to puzzle through that.
And what is the number of unfilled positions in the Be Heard program?
Do you know that? I think we'd have to get back to you. We can let you know.
Okay. Okay. And do you believe that the expansion is the correct move for the unit if they're unable to properly service the public with the resources that they already have?
Every time we expand, we do it with a full complement. So, we're not expanding unless we have all of the positions and all of the resources that we need. And we'll continue to do that and look at the metrics and then circle back before we make additional expansions.
Okay, thank you. I want to switch over to EMS now. Over the past year, workplace violence incidents for EMS members has doubled, making this year the most dangerous year for EMS. The department has partially attributed this increase to encouraging members to report incidences and that they are more familiar with the process. Does the department also believe that the number of assaults has increased on EMS members, or is it due to the increased reporting of those incidences?
It's probably both, and both of those things are critical. It's critical that they report this so that we can accurately track it, and obviously it's critical to acknowledge how dangerous of a job EMS is as well. And also would like to note, we have been also providing additional training to members of EMS because of that. Chief,
is there anything specific? Oh, go ahead, I'm sorry.
Yes, I agree with the commissioner. We have given them de-escalation training as well as self-defense training because we know that inherently EMS work is just dangerous in itself. We encourage that they report those incidents, and then we work with the district attorney's office as well as NYPD to make sure that people are prosecuted that assault the EMS workers.
Is there anything being done to protect them? We've spoken many times about some type of Kevlar vesting for them being made available to them. So is that something that that you're going to put into your budget or earmark money for, where they would have their own personal Kevlar vests that were at the fire stations for them?
Every EMS worker has Kevlar vests. We have done a 5-year rotation, so after the 5-year period, they are able to change out that Kevlar vest, but every member that's assigned to EMS operation has been assigned Kevlar vests.
Thank you. Of the 39 city entities with a capital budget, the fire department's fiscal 2023 to 27 capital plan is the 17th largest, totaling $1.514 billion. The executive plan over the 2023 to 2027 timeframe is $14 million more than the $1.5 billion in the preliminary plan. The largest section of spending in the plan is for vehicle acquisition, with $151 million this year. What are the largest areas of spending in the vehicle acquisition? Is it engines, ladders? Like, what are the specifics?
The fire apparatus are very expensive per vehicle, as you can imagine, and also we have a very large ambulance fleet. I don't know if we have a further breakdown.
It is primarily frontline fire apparatus, so replacing them on their replacement cycle. You're actually seeing more of that funding front-loaded in the current year, in part tied to supply chain delays that we've seen. We have to place our orders sooner in order to make sure that we get them in time for the replacement. That number actually doesn't include our ambulance replacements, which are funded in the health and hospitals budget.
Thank you. The second largest spending section is the facility improvements, of which the renovations is a significant portion. Please describe the current state of renovations with engine companies and why it's necessary, and how the FDNY will decide which houses need the upgrade, and how the company will operate while under construction.
So as you know, many of our firehouses are quite old, and as a result require significant renovations at times in order to continue to be operational and safe. The decisions are made in consultation between facilities and operations about which houses are in greatest need, and then where that company will be relocated, both so the company has a place to be and so that the neighborhood remains having coverage. So those are pretty complex decisions made with a lot of people at the table. EMS Station 17 has had its funding shifted from fiscal 2023 to 2024. This project was a total cap cost of $76 million. Do we know why this funding was shifted? There was a delay.
Yeah, it's just to reflect the current project schedule. So we're almost through FY23, and that contract hasn't registered yet. We're expecting construction to begin in winter of next year.
Okay, and the Be Heard program was expanded. With the expansion requires the need for more ambulances. You mentioned ambulances before. The fiscal 2024 executive budget has $35 million for 50 Type 2 ambulances set to be completed by fiscal 2024. What's the current status of the acquisition of those ambulances?
So we are working with both DCAS and OMB on that process as we speak.
And do you think it'll be completed by fiscal 2024? Or is there a chain issue, global chain issue?
There is certainly a supply chain issue. We believe that we will register the contract by that point. So the capital commitment plan reflects when the contract will be registered and not necessarily when the amounts will be liquidated or when we will receive the vehicles.
I'd also just like to point out the supply chain issues are not only significant enough, but they're national. So we've been working with the U.S. Fire Administration to talk to some of the manufacturers about how to better anticipate when the supply chain issues will be resolved and how they'll affect us down the road.
Thank you, thank you. I'll yield now to my colleagues.
Okay, we've also been joined by council members Farias, Stevens, Holden, Powers, and Hudson. We're going to start with questions from council member Schulman, followed by Holden.
Good afternoon, all. Good afternoon, Commissioner. So my question is, every agency seems to have a role with the asylum seekers, and I wanted to know what role FDNY played with the crisis that's going on.
So we are part of the interagency working group that meets almost every day to discuss both, how we can play a role and how every agency can help solve this problem.
Are any fire facilities being considered to house the asylum seekers?
Not right now.
But that's open for conversation?
I don't know what facilities those would be, so I don't think that that's an active conversation.
You didn't say absolutely not. That's why I asked the question.
Fair enough.
In terms of where they're being housed now, I presume that because you're part of the working group that you keep an eye, because these are, especially if it's a congregate facility or something like that, where there may be people that, that there's an issue in terms of fire response or anything else. I assume you keep.
Yeah, the reason we're part of the working group is not because of our facilities. It's because of looking at, whether it's some of the increased medical needs, if there's going to be additional 911 calls, or whether or not there are fire safety issues, or even issues with the facility itself that need to be addressed.
Do you anticipate needing additional resources to cover this issue?
Not right now, but like I said, this is, as you know, unfolding daily, and we are working with the whole city to keep an eye on what that's looking like daily and how it's affecting agency operations. So not right now, but we will circle back if that changes.
Okay, thank you very much.
Councilmember Holden, followed by Feliz.
Thank you, Chairs. And thank you for your testimony, even though I missed it.
It's okay.
I particularly want to talk about the lithium-ion batteries, which most people want to talk about because we're hearing it every day. How many, who inspects, if there's a complaint over 911, who goes out? Are there fire inspectors, firefighters, who goes out?
So it depends on the nature of the way the call comes in and whether or not it's an immediate life and safety issue, but all of the above.
All of the above. So a firefighter in a firehouse in a neighborhood could go out from
a fire company, if a call comes through 311 and it's in their local administrative district and it's an immediate safety issue, the local company could be called.
So if we had a complaint where, I think I mentioned this to you, that we had a number of bikes being charged outside of a home or two-family home in front. I just don't want the building department to go there. I'd want somebody who's an expert. Is that happening? That we're not getting building department saying there's nothing wrong?
Yeah, if a call is coming to 311 and it's urgent, we would often respond. In some cases, DOB does also respond. Sometimes we might call another city agency in, so it depends on the nature of the call. I don't know if you want to.
Yeah, we get a lot of those complaints, not particularly to e-bikes, but life safety complaints come in through 311. The local fire company goes and mitigates it through either witnessing the situation mitigated or issuing violation orders.
Yeah, but I could see a lot of people being concerned if they come into their hallway and they see a bike being charged or a battery being charged. Do you get those complaints? Are there a lot?
We do, and actually one of the most interesting things is we've seen those calls go up significantly, which we hope means that our public safety announcements are getting out there.
And what's the usual response on that?
It would be the same. It would generally be the local company, or if not, it would be fire prevention.
But it would be within hours, not days?
Yes, if the local company is called, it's hours, if not minutes.
It's immediate.
So I'm anticipating we need more inspectors or just more personnel to look at and who are experts on this, because this has to be complicated since it's relatively new technology and there's probably new products coming out on the market also at the same time. How do you keep up with this and train personnel? But how many inspectors do you have really dedicated to the lithium-ion batteries?
So let me take the first part of your question. We can talk about the inspectors, which is when it comes to the technology, absolutely. We are part of something called Big City Fire, which is under the Department of Homeland Security, and that looks specifically at technology nationwide. So we're also working with the Consumer Product Safety Commission, as you know. So we are really looking at every possible way, not only to regulate these, but to your point, to get ahead of this battery technology and make sure that we're regulating future products and future types of batteries. And our Bureau of Fire Prevention has been a phenomenal resource in doing this. Many of them are very knowledgeable, as are our fire marshals, who work with the ATF, among others, to make sure that we're keeping ahead of this technology.
You mentioned other agencies. Are there other agencies that could help with the effort? Like you mentioned, let's say people within who know the technology and can go out and look at something and
yeah, exactly. The mayor's blueprint is an interagency working group, and so that pairs us with other agencies that might not only have that expertise, but who are working with the deliveristas or working in the supply and demand area of this market to let us know, what would work to curb the use of these.
Thank you. Thank you, Chair.
Councilmember Feliz, followed by Farias.
Thank you, Chairs. Hello, everyone. Good to see you all. Welcome back to City Hall. Want to start by thanking our FDNY firefighters for everything that they do. Firefighters work at all hours, every single day, away from home, putting their lives at risk to keep New Yorkers safe. So we're very thankful, very grateful for everything that they do. My first questions are about lithium-ion batteries. This is obviously a topic that is somewhat new. We continue to learn about it every single day. And about 2 months ago, we passed legislation requiring that batteries be certified in order to be sold, e-bike batteries. Just curious, since passing this legislation, is there anything new that we've learned about these batteries and their fires being caused, such as, for example, batteries that might be safer, non-UL related batteries that might be safer?
Yeah, we continue to look at new types of batteries that were coming out. We also, as I mentioned, work with some of our national partners to actually send these devices out and have them look at them after a fire. So we can try to understand what exactly is failing and what regulations could be put in place to ensure that those failures don't happen.
Yeah, and based on the studies that you've done, what are batteries that might be safer than others, non-UL related batteries, if there are any?
So I would say there are some key things that make any device safer, and that's a battery that's not tampered with. That is a battery that has some, there are other certifications other than UL, but a battery that has been certified by one of these labs. Using the charger that came with the battery, using the right battery, bike, and charger that came together. All of those things we know make any electronic device with a battery safer. And I would point out, as I have many times before, that our laptops and our phones also have these batteries in them, and they don't have these issues, and that is largely because they have things like a heat sensor that turns the device off if it gets too hot. They don't charge with chargers that don't come with them. They can't be tampered with. So we know that those basic things, no matter the device, will make a battery-powered device safer.
Okay. How many fires have we had this year, and how many have been due to e-bike batteries?
So far this year, we've had 81 fires related to e-bike batteries.
Sorry, repeat that again, 81?
81 related to lithium-ion batteries.
And that includes the one we had like 2 days ago, right, in the Bronx?
Yes, it does.
Got it. Okay. Final question. Time runs really quickly when you're in here. FDNY recently passed a new rule related to EMS ambulance costs. I think the pricing increased from like $900 to $1,365, if I remember the number correctly. How will this affect low-income families taking into consideration the insurance that they generally have?
So those price increases were directly related to increases in the cost for insurance companies that are paying these bills. We have a number of programs to help ensure that low-income New Yorkers do not have to pay that full cost or even a cost at all if they can't afford it, and we'd be happy to fill you in on how your constituents can get access to those programs.
Perfect. Thank you.
Okay, we have Farias followed by Powers.
Good afternoon, everyone. I know, I feel like I'm doing stand-up comedy now. Thank you, folks, for coming out today and your opening statement. Just want to go through some quick questions around recruitment, retention, fire academy, and then some capital projects. In 2018, then Commissioner Nigro expressed a desire to have 15% women and 50% people of color firefighters in FDNY for 2030 at a council hearing. Is this a marker that the FDNY is still working towards? And if so, what has been put in place to make this a reality?
Yeah, it is a marker we're still working towards. As I think we've talked about in past hearings, our last list was the most diverse in department history, and we are close to kicking off our next firefighter recruitment campaign, where we will use all the successful tools we used in the last campaign in order to increase those numbers, and I'll have Commissioner Noonan add to that.
Sure. Good afternoon. We've conducted a very deep dive of analysis based on that last historic campaign. And what we looked at is the type of events that we attended, where we met those candidates that were successful test takers, right? So also what level of engagement did we give them that got them there, and making sure that we are mimicking that in our upcoming blueprint for the next campaign. We looked at the types of advertisements they received. We looked at the various programs that they participated in, including our tutorial program, which was effective in making sure that those candidates that were preparing for the upcoming exam were able to score better on the exam because they attended those tutorial programs. And so a lot of, like I said, what we've learned and the analysis that we've put forth will be seen and we'll be able to execute for the upcoming campaign.
Great. And in terms of either looking at some of that data or with the upcoming class that we just had, were there women-focused recruitment events that the FDNY has planned, or yeah?
Absolutely, women-focused recruitment events, and a lot of those, whether they be schools or colleges, you know, a lot of our women that we recruited that were successful were not necessarily at women events, but, you know, a very large majority, I would say about 43% of our interests that are in our CRM are women. So regardless of whether it's a women's event or just a general event, our focus is always on recruiting women.
Awesome. And does the FDNY offer any women-only sessions when training recruits?
Actually, when we just did a recent kickoff for our upcoming CPAT exam, which is the physical fitness exam, and we always start that all out with inviting the women and making sure that they really understand what the physical fitness portion of the exam is about to involve and the level of commitment that they will need. And so they're supported by many female firefighters that come out to talk to them and just give them their experiences. And even some women that had recently passed the exam were there to also give their experience. So it's a great way to start, and then we continue that by offering CPAT training, a full complement there, and additional fitness programs to make sure that they're able to make it through.
Okay, does that also mean, and I didn't see this in any of the like new asks or anything in the budget, have we looked at an area in the budget to design our own training, like women-only training that maybe is supplemental to having childcare or things like that that we know are maybe the inhibitors for having more women successfully go through the academy?
So we have looked at that. You know, one constraint we have is on whether or not funding can go to a women's only program. And so what we've done to work around that is the United Women Firefighters is a fraternal organization of female firefighters, and they run a number of women's fitness programs that both the council has supported, many of you have supported, and we've supported over the years.
Sorry, chairs, can I have additional time? Sure. Thank you. Is there any reason particularly around why the FDNY hasn't sought a way to create a line item for the organization, for example, to do training?
We did once, and actually the council had to decline that because they could not fund a women's only program.
Interesting. I will continue.
That was
to
I think about 5 years ago, so we can get you the details.
Okay, and just my last couple. Does FDNY report on or have any statistics on the gender and racial demographics of those who have failed FDNY tests?
We do, we look at the entire life cycle of candidates and that breakdown at each and every stage of the process so that Nafisa's team can plan interventions based on what they're seeing and the trends in the data.
Okay, and have we conducted exit interviews for firefighters who have resigned from their positions in the past? Is that?
I believe so, but we can double check.
Okay, and then my last capital questions. I looked at the capital budget, didn't see anything under the new asks, even though we're excited to build new firehouses, which I saw there. Are there separate locker rooms or changing spaces for women in the firehouses and training facilities? I know we passed that law, and we're slowly implementing. I know you've mentioned that our firehouses are a bit older, so that requires more work.
Yeah, so some firehouses do. Any new renovation includes that, as you mentioned, because a number of the firehouses are quite old. You know, it's very hard to do a partial renovation or to find space, and so that's why I say when we do a full renovation, that's already part of the spec for the next few decades.
Okay.
We also have the council legislation, which is we are doing that survey, and of course we'll brief the chair and yourself once that survey is complete.
Great, and just because of the work that the council's done here with lactation rooms and pumping stations in our own old buildings, how's that working out for our firehouses?
Yeah, it has been working out. We also have those pods. You actually see them in airports as well. We have used that in certain facilities where the facility itself might not accommodate it because of the age of the building.
Okay, great. Thank you so much. Sure. And thank you, chairs.
We have Councilmember Powers, followed by Brewer.
Thank you. Nice to see everyone. I just wanted to follow up on a question that was something you said, and then Councilmember Holden followed up on. you said noted that 311 calls are up for battery complaints. Can you clarify what those complaints categories are? I assume it's probably somebody bringing a bike into a building or something like that. Second is, I just want to clarify, what is the process after that call comes in? So what happens? What is the average response time for something like that? If it's a complaint about a bike going into an apartment or a building, how do you verify that, or what is the steps taken? I have some follow-ups, but just want to start.
So I don't have the breakdown in front of me. We can get that to you in terms of the type of complaint that's coming into 311, but generally, battery related, things like someone's charging, multiple bikes or multiple batteries in a building or a hallway. And as the chief mentioned, depending on the nature of the complaint, the response is quite quick, and then the follow-up depends on the condition that they find. One of the biggest issues we continue to have, and obviously look to the council, is that many people have these in their apartments or in their private homes, and that's the one place we can't inspect. So that continues to remain to be an educational issue.
So if I call and say I have a neighbor charging in my lobby of my building, public space, 5 batteries, I put a 311, it's not a 911, that's not a 911 call, I presume it's a 311 call. I call 311. What's the steps taken from there? And would there be is there a violation that would be issued in any instance?
Well, so it depends on the nature of what they find. I'll let the chief follow up on that.
Yeah, there is some degree that is allowed, but if it crosses that threshold, there would be violations given. They would make them remove them.
So what is the threshold?
You're allowed to right now charge up to 5 within dwelling.
And that's by FDNY regulations?
Fire code.
Fire code. Why is it 5?
It's being looked at now. It's it needs to be probably we need to see where we need to go with that. But the 5, I'm not sure how they came up with that number, but that was agreed upon when we wrote the fire code.
Okay. And are buildings allowed to tell their tenants that they can't bring in battery-operated bikes into their residences or building?
Yeah, many private buildings have that in place. I will point out the job that was in your district, the roof rope rescue caused by an e-bike, that was a building where they were banned. So even though many landlords do ban them, again, as I mentioned, a lot of people have these in their private apartment or homes, and even the landlords are unaware.
Okay. Final question. Chair Ariola had asked about the legislation which I sponsor, which is around the buyback. Just want to clarify your position on that. I know you said you support any effort. I want to know if you support that piece of legislation.
So I don't have the legislation in front of me. We can double back to you, but I would say that any effort to get the unsafe batteries off the streets and safe batteries into the hands of delivery workers is something that we would work to support.
Generic answer, but I'll take it. Thank you.
I'll circle back.
Okay, thank you.
Councilmember Brewer.
Thank you very much. On the batteries, I know you've been such a good leader on it, but the bill that we passed, I don't know that it does much good, but it basically says you can't sell the tampered batteries. Is there any place, because you can't do anything about a home, are there places that you have found that are selling them? Obviously, online, I don't know what you can do except ask them not to. So I'm just trying to see if there's any place that this makes a difference, number one. And then secondly, obviously, if we're not going to be at home, then we need a place. And so far, the idea of doing charging has been a real challenge. So I just didn't know if there was any update on that.
So I don't have an update on the charging, but I will say it is something that we are actively looking at and working on with the working group. When it comes to your legislation, absolutely, it's made a difference. We have found a number of locations that are selling either illegal batteries, tampered batteries, or have far more than 5 devices, or in some other way are doing something that's unsafe and against the law. And so we have been able to do a number of sweeps of those locations. When it comes to online marketplaces, that's where the Consumer Product Safety Commission comes in. They have removed tens of thousands of devices from those sites and are working to remove others, as well as stopping these from coming in through the ports. So there is real work being done there. Again, I know I keep repeating myself, but these are in people's homes right now. And so that's one of the biggest concerns for first responders and New Yorkers is even if all of this goes into effect soon, which it will, we will still have people who had purchased these devices previously and have them in their homes now.
I'm aware of it. Number two, this issue of when a business opens or I guess gets reconstituted, it often needs restaurants, et cetera, FDNY. In the past, when you first started, there was a lot of backlog. I'm wondering if that backlog has been negated and it's better, because it's really hard to open and then not be able to get FDNY to sign up or sign off.
Yes, we made significant progress on that backlog, thanks to the mayor's office, thanks to a number of folks here. That went from, I think it was about 16 weeks down to just a few weeks, and that was thanks to an effort of everyone.
Well, it was
in the fire
months
department.
in the past. So now you're saying it's, what do you think it is now for the backlog for a new business?
I think it's at a few weeks, but we'll double check. And
If I could get that
yeah,
information.
two to 3 weeks.
Okay. Next, sirens. Now, I know I have to make it a budget issue, so I will. So my question is, are you putting any money into thinking about how to have ambulances in particular? If I get one more complaint about an ambulance, it's just all day and all night. I live between two hospitals, maybe that's why. But my question is, what are we going to do, if anything, about sirens on ambulance to reduce it? Make them safe, the patients safe, but, I mean, I'm a rumbler person, but I don't know if that's what you want.
Yeah, so a number of years ago, we began to switch our fleet over to rumblers. So that is an ongoing effort to make that change. Lizette may have an update on that. And we also, regularly work with EMS operations to make sure that we're going lights and sirens when it's required for the patient, and not if it isn't. But I do think the reason you're hearing so much of that siren noise is not just where you live, but EMS call volume continues to go up. So EMS is very busy.
I know, but hundreds of people complaining. So we have to have further conversation. There must be some way to reduce the noise and still have the person get to the hospital on time. It's like hundreds and hundreds and hundreds of complaints. And then just finally, just as a minor issue, but when you're on streets, like at 100th Street, you've got NYPD and FDNY. They're both fabulous, but the car situation is such that, it's 3 deep, streets can't be clean. So just a suggestion, when you're in a neighborhood, we've got to figure out how you can move the car so that the streets can be cleaned. I don't know if that's a problem elsewhere. On 100th Street, it's a mess. Just if we could talk about that later. Thank you.
Absolutely.
Okay, I want to thank the panel for coming. Commissioner, thank you for being so forthcoming with your answers, as was your entire panel, and so prepared to answer questions. I want to thank my colleagues for their questions, and again, our financial analyst, Tanvir Singh, unit head, Jack Story, committee counsel, Josh Kingsley, political analyst, Will Hongash, and my chief of staff, Phyllis Cirillo. Mostly, I want to thank our finance chair, Justin Brannon, for all the hours he's been putting in. As you said, it's his 7th committee hearing, and we're not finished yet. What? 7th day.
Thank you both for supporting the
agency. And he's not finished yet. And I want to thank his wonderful committee counsel for all the work he does. Thank you so much.
Commissioner, thank you. Look, I appreciate, obviously, the 5th firefighter and EMS pay parity can't happen without collective bargaining. I just hope that there's, when you get to that table with the unions, that these things can be prioritized. It's the only way it's going to happen.
I couldn't agree more. I have spent many, many hours, including a number of overnight sessions at OLR across the table, and I will continue to do that as commissioner. It is my #1 priority.
Thank you, guys. Stay safe out there. Thank you.
Thanks.
Okay, with that, day 7 of executive budget hearings is, oh, you have a question? You sure? They're here. Councilmember Velasquez.
Always late, huh? Just very quickly on diversity hires, and what are you doing to promote more diverse FDNY?
So we, have made a number of firsts in our appointments, as you know, as well as we're looking to capitalize on the success of our last firefighter recruitment program. We can give you a quick synopsis, but we are going to kick off our firefighter recruitment campaign and use many of the successful tactics that got us a historically diverse list.
Thank you.
You want to?
Thank you guys very much.
Thank you.